I keep hearing two opposite rules: drink only when thirsty, or force a giant water bottle all day. If water is so basic, why is the advice so messy? Is there a real target, or does hydration change too much from person to person?
Hydration is less like filling a tank and more like running a control system. Water moves through blood, cells, and the spaces between cells. Your brain samples concentration, your kidneys adjust urine, and hormones help conserve or release water. So the practical question is not, did I drink a perfect number? It is, are intake and losses matching today's conditions? Also, water intake is not only plain water. Beverages count, and many foods count, especially fruit, vegetables, soups, yogurt, and cooked grains. The body ultimately sees absorbed water and dissolved particles. That matters because a salty meal, a high-fiber meal, alcohol, caffeine tolerance, and total calories can all change thirst and urine output without meaning you're broken.
So, should a healthy adult trust thirst most of the time? Or is thirst already a late alarm, like the body saying, you missed the window?
For ordinary days, thirst plus urine color is a reasonable rough map. Pale yellow usually suggests adequate fluid, while very dark urine can suggest concentrated urine. But it is not a lab diagnosis. Vitamins, some foods, medications, first morning urine, and timing after exercise can mislead you. Researchers often use urine-specific gravity or osmolality because color alone is coarse. Sweat is where the math changes fastest. In heat, protective clothing, long sessions, or high-intensity work, you lose water and sodium through skin while trying to keep blood volume and temperature stable. That is why body weight change around exercise is useful. A sudden drop mostly reflects fluid loss, not fat loss. It gives a personal estimate of sweat rate.
Before we get athletic about this, who should not copy general hydration advice? I'm thinking of people with heart failure, kidney disease, or medications where fluid and sodium are not casual variables.
Exactly. And for people without those restrictions, electrolytes are not magic. They are context tools. Sodium helps retain fluid in the extracellular space and supports nerve and muscle function. If you're doing a short, cool walk, water is fine. If you're sweating heavily for a long time, replacing some sodium can help the fluid stay useful instead of just passing through. A useful recent example used simulated firefighting in full protective gear. 24 male firefighters drank 1 liter during the first recovery hour. Water, a carbohydrate electrolyte drink, or the same type with menthol. The electrolyte drinks improved rehydration rate compared with water, and several markers favored them, including salivary osmolality and urinary sodium. Menthol did not improve rehydration, though performance signals looked interesting. But we should separate hydration from performance marketing. A 2026 systematic review of carbohydrate during endurance exercise and heat found mixed performance effects. 5 studies showed benefits, 4 did not. Carbohydrate intake did not consistently improve hydration, thermoregulation, or fatigue markers versus placebo. So a sports drink may be helpful for fuel, sodium, taste, and adherence, but it is not automatically superior for every workout.
If someone is not an athlete but does summer hikes, long shifts, or pickup soccer, what feedback should they use? I don't want them memorizing grams per hour and ignoring how they feel.
Look for patterns, not one perfect sign. You should be able to exercise or work without unusual dizziness, pounding headache, confusion, cramps that are new for you, or a dramatic weight drop. Urine should not stay very dark all day. Thirst should settle after drinking. If a new plan just makes you urinate constantly and feel bloated, that is not better hydration.
What about the other side? People who keep drinking because they're scared of dehydration. Can overdoing plain water actually become dangerous, especially in long events?
Yes. The concern is exercise-associated hyponatremia. Blood sodium becomes too diluted. The risk is higher when someone drinks far beyond thirst for hours, especially if kidneys are conserving water during stress. Mild symptoms can look vague, But severe hyponatremia can cause confusion, seizures, or coma. That is a medical emergency, not a situation to solve by drinking more water.
Where do pregnancy, older age, fever, vomiting, or diarrhea fit? Are those just drink a little more situations, or should people think differently?
They should think in terms of loss plus vulnerability. Fever and diarrhea can lose water and electrolytes together. Pregnancy changes fluid demands, but persistent vomiting, inability to keep fluids down, fainting, confusion, very low urine, or severe weakness deserves medical advice. Older adults and people on diuretics also need caution because both dehydration and overcorrection can happen. My simplest ladder is this. Start with thirst, meals, and normal urine patterns on ordinary days. Add planning when heat, altitude, long exercise, protective clothing, alcohol, or illness enters. Add electrolytes when sweat or gastrointestinal losses are substantial. Add medical supervision when heart, kidney, pregnancy complications, severe symptoms, or fluid-restricted care enters. Hydration is successful when the plan matches the day, not when the bottle looks heroic.